I'm Bill Elliott. I'm a registered nurse and a paramedic. I work for Lawrence County EMS and also work for Pentec Health as a nurse. I'm from Proctorville, Ohio. On August the 24th, I had a heart attack. I was riding dirt bikes with a friend of mine. It's his son. It was his son's birthday. And the pain hit after we'd been riding for a while. And it went from a little bit of pain to a lot of pain. And I realized I couldn't drive myself. So we left all of our gear there, and my buddy drove me to meet an ambulance. I've been having some chest pain for the 4 or 5 days. I was working full-time EMS at the time, and it was 24-hour shifts, 48 hours off. And I've been having this pain, and it just really mimicked what I felt like when my anxiety was bothering me. So again, I ignored it. And I'm thinking, I'm 54, I'm not having a heart attack. My dad, he had a bad heart attack or two in his middle to late 70s. His doctor told me, beware. Again, I didn't take heed in that very well. My chest pain got so bad, it was like, I can't drive. So when I called the dispatcher, they told them what was going on. I said, I think I'm having a heart attack. I really need to meet an ambulance in Grayson. And he said, well, let me transfer you over to Carter County. So by then I was hurting so bad, my friend Don had to finish the phone call, but they met me. They were there as soon as we pulled in. I asked them, I said, are you an advanced life support crew? And they said, yes, sir, we are. And that was the second link in my chain of survival that day. I felt like I arrested, and he defibrillated me. And I came around coming in. I started coming around as we backed into the ER bay. The ER doc, I think his name was Dr. Collins, he was right there with me, and he kept promoting, he kept saying, hang in there, you got this. And he took the bed actually and went running for the cath lab. They moved me from that bed to the cath table, and the ER doc was still there with me and talking to me. And Dr. Epling, he came in and talked to me briefly. And I remember a couple needles going in my leg, and went out again. I guess I went back into arrest. They defibrillated me again, and I woke up in ICU. It's the one that they often call the Widowmaker, and they put a stent in there, and he said everything went fine.
For emergency heart cases, there is a time that we call door to balloon time, and that is the time the patient arrives to the emergency department until they go up into the cath lab and have treatment. The national goal is 90 minutes. Here at King's Daughters, we strive for 60 minutes. Bill's time was 30 minutes. This is important because time is heart muscle, and so the quicker that we can get intervention and open up that blocked artery, the more heart muscle that we can save.
From an EMS standpoint, if you have chest pain, if you have stroke-like symptoms, breathing difficulties, you need to be seen immediately. You don't need to delay care and not go to the hospital. And no COVID is something that everybody's worrying about right now. But a heart attack is very important. It's more important than that, because you're going to damage your heart, possibly die from it, and not be able to recover from it. God was with me that day, and he put the right people in my life that day, whether it be my friends, Carter County EMS, or my new friends at King's Daughters, the emergency room, the cath lab. Everybody was instrumental in saving me that day.